I did, when I went to the Senate, I founded with a couple of other people, Senator Cornyn from Texas and a couple of other members, the Community Health Center Caucus. We just decided we were going to spend more time talking about this part of healthcare. I think for beginning to get into the general discussion, but for a long time, the community health centers just weren't factored in. Of all the discussion you'd hear about, well, these people, here are the Americans that have no access to health care and so on and so forth. That never factored in a place you could go, and if you run a government program, they take care of you on a government program. If you had insurance and wanted to come here, you can be taken care of if you have insurance. If you don't have either of those things and you're paying yourself, there is a sliding scale that's very workable. And for the first couple of decades of community health centers, that healthcare provider and that access to healthcare was never figured in to any national discussion. When President Bush was president, the Secretary of Health and Human Services and I started talking about what we needed to do to be sure that this was an understood part of the healthcare delivery system for the country, and not only how big a part it was, but how the model could actually work. So on the basis of the model, Senator Stabenow, a Democrat from Michigan, and I, in 2013, introduced some legislation where we would have, as it wound up, it turned into an 8-state pilot, where behavioral health would also be included like all other health, but using, this is the key to the community health center element, using that very same model, where at the end of the year, you sort of calculate everything that's come in and everything that's gone out, and whatever that difference is, you make an effort to be sure that that gap is closed. And this takes good management. It takes the ability of knowing that that money, the federal money, is out there in a way that allows you to go to the bank and borrow the money that you need to borrow. This is not a government paid for building. This is paid for by the center, just like the other facilities are. Let me go back on behavioral health. Again, we're one of 8 states that's, in July, we will have ended the first year of a 2-year pilot, to where if you go to, in many cases, the community health center, but you have to meet the right standards of accessibility and staff, and in our state, 200 different locations where you can go, and if you've got a behavioral health issue, it's paid for just like any other health issue, which is clearly what we should have been doing for a long time. The NIH, the National Institute of Health, says 1 out of 4 adult Americans has a diagnosable and almost always treatable behavioral health issue. So 1 out of 4 is a pretty big number. Mm-hmm. This is not just somebody none of us know. This is several people in this room probably. Maybe starting with the senators. Why would you do this if there wasn't some reason that you don't understand? And that 1 out of 9 adult Americans has a behavioral health issue that impacts how they live every day. And I think what we're going to find in this pilot will be that if you actually do deal with people's behavioral health issues, the other health issues that they have are so much more easily dealt with, that you have the advantage of it. One, everybody knows it's the right thing to do. I think what these 2-year pilots are hopefully going to create enough, broad enough base of information that people will also understand it's the cost-effective thing to do. If you're taking your medicine, seeing your doctor, feeling better about yourself, eating better, sleeping better, going to your other medical appointments, whatever other problems you have are going to be dealt with much more easily than if you're struggling with that mental health issue. So that's another place where more and more community health centers are stepping up.